Hello, my name is Andre Ward, and I'm the Associate Vice President for the David Rothenberg Center for Public Policy at the Fortune Society. Welcome to Both Sides of the Bars. Today's segment is part 2 of a webinar entitled COVID-19, Rikers Island, and Technical Parole Violations. At a time during the COVID-19 pandemic, it's important that we learn what's happening to people on Rikers Island and how they're impacted owing to COVID-19. So in part 2, we'll learn more and hear from what the experts have to say about COVID-19 Rikers Island and the impact that COVID-19 is having. And we ask you to pay close attention as you look at this segment on Both Sides of the Bars. I want to transition now to Many Schiraldi. Many Schiraldi is a senior scientist at the Columbia Justice Lab, the former New York City commissioner on probation. And so, Vinny, I know as an academic and a social scientist, like you've written extensively around parole reform. So talk to us about the relationship between like COVID-19, Rikers Island, parole, technical violations, that intersectionality as it relates to parole reform in particular. So talk to us about that, and thank you for joining us, Vinny.
Sure thing. Thank you for having me. And I want to start by dedicating everything I have to say to Michael Tyson and Raymond Rivera. They're the first 2 people that died coming out of Rikers Island, or in Rikers Island. Both of them were locked up for technical parole violations. And I want to be real careful about not sort of segmenting populations. Nobody deserves to die in Rikers Island. Nobody deserves to be in the conditions the people in there are in. The people who are incarcerated there or the people that are working there. It's truly, truly awful. It's, you know, we had Rachel Bedard, doctor from Rikers Island, speak on our staff meeting last week, and it was just crushing to hear what she was talking about and how widespread the infection is, how impossible it is to socially distance, how impossible it is to be clean, how challenging it is to test enough people. And this is even as Dr. Cohen said, when people are trying hard to do the right thing. So I want to say that because I know we're focused on technical violations and, you know, everything's got to have its own focus, but nobody, violent offenders, unviolent offenders, so-called, nobody deserves to be in unconstitutional, horrible, disease-infested conditions where they're forced to be proximate to other people. That said, New York is particularly bad on people who are locked up for technical parole violations. We're the second worst in the country, behind only Illinois. And that just depends on how you count, because there are 2,000 people that get locked up in New York every year who volunteer to go back to prison to treatment. Because if they didn't volunteer, they'd be held for a technical parole violation and most likely technically violated and given more time. So if you added those 2,000, we'd be number 1 in terms of locking people up for technical violations. Costs over $600 million a year, money we could use right now to treat people, right now to house people, right now to help people get jobs and help them turn their lives around. But we are pissing it away, locking them up in dangerous facilities in New York City and around the state. So that's what's happening with that. Assemblymember Mosley and Senator Brian Benjamin have courageously authored the Less is More Act. It would dramatically reduce the number of people who are locked up for technical violations. It would give people recognizance hearings. A fascinating thing that Corey Stoughton could maybe talk a little about was how the state, in defending itself against their lawsuit, attached the Less is More Act and said, we don't need the remedies being asked for by legal aid, recognizance hearings for people who are facing time, because the Less is More Act has been proposed by Assemblymember Mosley, even though it hasn't been passed, even though the state hasn't endorsed it, even though the state hasn't done it essentially administratively, because most of what we're saying in Less is More, the parole board and parole division could do right now. They could stop technically violating people. 41 additional people have been sent to Rikers Island since the governor announced that he was releasing people on technical violations on March 27th. That's just in New York City. That doesn't include the rest of the state. So it's terrible for people to be in for any reason. If my husband or wife or daughter or son were locked up there, I'd be freaking out right now. It's especially outrageous when they're in not even accused of a new crime, because that's what a technical violation is. You're not even accused. So I get it that we have to struggle over who to release, right? I get it that there's another side to this discussion, that people are afraid of letting dangerous people out. I get that. Can't we categorically start by saying nobody comes into this place for a technical violation, and everybody who is in on it goes home? And last point, the governor's order to release people. First of all, only half as many people have been released from Rikers as the governor said he would release. And second of all, it doesn't touch the remaining 4,000 people in state prisons who are in on technicals. You know, the doctor at Rikers, Dr. McDonald, said that a storm is coming. And a storm is indeed coming. It's actually hit Rikers, and it's going to hit all the state prisons. Some of it's already hit. But you know, when there's a hurricane coming to your house, you don't wait till it's 100-mile-an-hour winds to take out the plywood and hammer and nails and start boarding up the windows. You board up the windows when it's coming. And what we're not doing is that. We need to get as many people out of state prison, and that includes elderly people. That includes not just technical violators. It includes people who are just short of finishing their sentences. Get them out of there so that when the storm hits, not if the storm hits, when the storm hits, there's enough people to go around, there's enough space to go around, you have more, a better staff to incarcerated person ratio, you have more healthcare providers, you're able to provide healthcare in the upstate hospitals that people are going to have to be rushed to if they get really sick. All this stuff is knowable. We know it now. And if it hits, it should not be considered a surprise when it starts to, I'm in Lake Placid right now. There's 4 prisons I can spit to from where I'm sitting, and there is not one hospital that I can spit to. If those people start getting sick and they need to rush to hospital, staff and incarcerated people, where are they going to go? Where are they going to go? We need to reduce those populations now. Otherwise, it is going to be an absolute bloodbath in these places.
Sure, and I want to thank you for those comments, Vinny. I want to transition to Tahani, if I'm pronouncing your name correctly. I want to transition to Tahani, I know, and then we'll get to Sarita, who's heading a lot of advocacy work at Just Leadership, to close off before we get into some Q&A, and then we'll have some final comments and calls to action from each of you. But Tahani, I know that you're heading up some of the prison rights advocacy work or attorney work at Bronx Defenders. Like, talk to us about what you're hearing as you're engaging people who are coming out and just what you're hearing overall.
Sure. So I just want to say thank you for having me. I also want to send my condolences to Mr. Tyson and Mr. Rivera's family. It's very sad that their fate, was what it was, considering the fact that they could have been released if the governor had acted quicker. So, Bronx Defenders, as well as Legal Aid, we have been filing a number of different types of mass writs as well as individual writs. We have had some success. But not as obviously not as much as we would hope. The standard is a little bit hard to sort of meet, as Corey mentioned. It's a high standard you have to show indifference on the part of DOC to the health and safety of people who are incarcerated. And one of the things that we're seeing is judges are very resistant to release people because their sort of logic is that if they were to find that standard for one person or a few people, they would essentially be finding that standard for everybody in there. And they're just not going to release everybody who is on technical parole violations or city time or pretrial, whether they're medically vulnerable or what have you. So we're seeing a lot of pushback in that way, and we're also seeing judges, really attribute a lot of credibility to the affidavits that are coming from DOC and the DOC lawyers and the letter from the district attorney's office, which essentially is saying, "Don't worry about it. We're doing everything that we can. We have this under control." And that's just literally not true. So, I mean, my day, 7 days a week, pretty much every single day since I would say probably the beginning of March, has been spent speaking to my incarcerated clients, initially in person when we were still doing visits on the island and also at MDC. Um, and now, on the phone and video conferencing, and listening to them cry, listening to them, ask what else can be done so that they don't die in prison. And some of these people are in on parole holds, technical parole violations. um, you know but there's confusion, there's mass confusion in the jails. They don't know what's going on. They don't know why they can't be seen when they're calling for sick call. They don't understand why they don't have masks, despite the fact that the mayor had mandated that everybody in DOC be given PPE. They don't understand, why they're being housed with sick people. There's no information sharing, and that's not just with the people who are incarcerated, right? Like, that's also with the COs. The correctional officers also don't know what's going on, and so inevitably there's a lot of mistakes and poor judgment being exhibited, and unsafe practices, and practices that are just sort of coming to be out of just fear of everybody on the island. One of the things that has been a challenge for our legal department, who have been filing the writs, is just collecting data. Like, everything that is going on right now is so fluid, and for almost 2 weeks we didn't have access to our clients through video conferencing. And so once that sort of came up and running, then we were able to check in with people, but there was a backlog in terms of getting to speak to people. But the CHS has been phenomenal in terms of making sure that we did get information on our medically vulnerable clients for purposes of individual and mass writs. But generally speaking, it's just been really, really hard to communicate with people, and just not knowing what to say to people, when they've received an ACD, or they've taken a technical violation for a criminal case that resolved, but they're still sitting there in a parole hold, and they have asthma, or they have respiratory issues, but somehow, some way, that's not enough for them to be released. So it's confusion, it's trauma, and it's sadness, and it's hopelessness. The conditions in Rikers are deplorable, even prior to COVID-19. We've heard about people not having running water. They certainly can't have sanitizer because it's considered contraband. There are people who are in quarantine dorms who they're with other people who are visibly symptomatic, and their beds are spaced 1 to 2 feet apart. People are getting coughed on. They're having to, people who are in solitary confinement. I do a lot of work with people who are in solitary confinement. They're saying that the slots that they receive their food and their mail through are never wiped down. And the people who are serving them their food are coming from other quarantined units, meaning that they've been exposed to somebody who had COVID-19, and they're not using gloves. And so we've seen people, in solitary confinement, who you would think wouldn't have much contact with anybody to get it, who are actually being diagnosed or being, tested positive for COVID. Same thing with phones. We have to be very careful about asking our clients to call us a video conference with us, because every time they are moved somewhere else, they're exposed, and there's not alcohol swabs to wipe things down. The video booths and the phones are not being disinfected, and the incarcerated people who are in there don't have access to that stuff to do it themselves. So it's a very scary, confusing, hopeless, I think, time for people who are in there, and their concern is just not dying.
Sure. And thank you for that, Tahani. And there is like some questions, one of which has to do with support around housing, right? People leaving Rikers to safe and stable housing is something that's really important to this discussion too. And I don't know if anyone has any comments on that. We only have 8 minutes left. And so I know the calls to action is really, really important too. And I know that the questions are equally as important. So I'll ask people to take a quick 30 seconds if they want to respond to housing for people obviously who are being released from Rikers. If you care to share a comment about that, and then we'll jump right into the calls of action before we end this webinar. We never have enough time, but anyone wants to kind of respond to that?
Sure.
Go ahead.
I'll respond really quickly. One of the things that I will note as a former civil action attorney working with people who are experiencing collateral consequences, and something that hasn't really been spoken about much, but these people who are leaving Rikers Island or being released from Rikers Island do have families that will take care of them. There are ways for them to come into the community and quarantine. But a lot of those people live in public housing, Section 8, project-based Section 8, NYCHA, and there are restrictions and permanent exclusions or just exclusionary policies and procedures in place for public housing that do not allow for people who have those vouchers or who subsidies in city housing to receive their loved ones back home. In fact, it could actually initiate or prompt a termination proceeding for that person, whereby they would end up either being kicked out of public housing or lose their voucher permanently or for a period of time, or they would have to opt to what's called permanently exclude their loved one. And so one thing that I would say is it is a way for the city government and the state government to sort of address this issue is to, I would say permanently eradicate those policies and procedures, but certainly suspend them for the time being, especially because homeless shelters are at capacity, hospitals are at capacity. It doesn't serve anybody for people coming out of jail to be on the streets. And hotels are being used, but sparingly, and it still costs the organizations in the city a lot of money to be able to put people up in hotels or in hostels or what have you. So that is one thing that I think needs more attention is the issues around public housing subsidies, city housing, that kind of stuff, and their policies and procedures around receiving people who have convictions on their records.
Got it. And I want to get to calls to action. We have 5 minutes left. Calls to action in 30 seconds as we wrap up. I want to turn this to Mr. Mark, Mr. Brown. And Mr. Brown, again, thank you so much for just sharing your experience with us. We really value it. It's really impactful, and it makes a difference hearing your story around doing this. So, Mr. Brown, in 30 seconds, a call to action. What should be done?
Well, I'm one of the individuals that's housed in the hotels because I'm in the shelter system, so they place it in hotels. Well, first call to action is you need to test people. We begged and begged to get tested. They never tested us. The only way you got tested is if you ever went to West Facility. And another thing is that when I left, they was not allowing officers to wear protective gear. I saw an officer come in with her own mask and a white shirt, which was a depot or a captain, told her she could not do that. So they wasn't allowed officers to wear protective gears. Not to protect them, but to protect them from us, because we inside. But one of the calls to action is to test it, because it's quite easy to test those to see who's actually infected and separate them from those that's not. In my housing unit, when I was released, it was 10 to 12 of us that had symptoms, and it was already 2 people that were taken out. But here's the kicker: when they designated these houses isolated living area in C95, they still allowed everybody to go out to medication to interact. And the virus is known to stay on certain surfaces 2 and 3 days. So even though they ran one house at a time, they still was allowing the inmate population to go out. I was a mess hall worker, so that I was allowed to go out and work with food even after my housing unit was designated an isolated living area. These policies and practices allowed the virus to spread a whole lot faster than it would have. There was preventive measures that could have been taken with the knowledge that they had. Sure. And so testing is very important. And like I said, all of us that were let go, that were released, whether it was by the mayor or the governor, I was released on a writ, one of the writs of New York County Defenders, because of my medical condition, I'm missing half a lung. They didn't test none of us. Right. And there's a segment of us that was definitely infected. Though I was never tested, I had flu-like symptoms, and I saw people around me. So therefore, we were never tested, but released back in the community. And those of us that were infected would have passed it to our loved ones, and they would have passed it on to where they was going to their love, and it was continuous. It's like a spread. And I'm not saying that this was done intentionally, but knowledge was present that could have told you, just common sense, that you can't do this. And with that, I'll end.
Thank you, Mr. Brown. Corey, 30 seconds. I know it's not enough time, but some calls to action.
Okay, so I would just say 2 things, picking up on something someone else said earlier. we got to think about the immediate around COVID. We need more releases. That's the first thing. And we also need to stop feeding the system. That gets to the policing issues Sarita was raising, and also the fact that DOCS is continuing to violate people for technical violations. Why? I mean, public safety includes our safety from this virus. Arguably, that's the most important aspect of public safety right now. And the notion that we're violating people for missing meetings or having a dirty test is outrageous. And it's a really challenging time right now, because I got to tell you, most people who aren't following this issue the way you all are by being here listening to this webinar, I think this problem is getting solved. They see that the Rikers population is down to 4,000 people. It's down 25% from where it was a month ago. That's an incredible accomplishment, but it's not enough. But a lot of people think it's enough. And they heard the governor make an announcement that he's releasing people. They think, okay, it's taken care of, but we've got to keep hammering that message. We're also, if I can just be real, we're starting to see the Willie Horton effect. We're starting to see the stories come out about people who have reoffended after being released. And it's just, we're in a really challenging moment. And if we don't keep that pressure up to continue to release people, we're going to lose that momentum, and there will be more people who die already. So that's really one thing. But the second thing is that long-term thing that someone said before, that the parole system in particular is just an incredible black hole. And if we don't take this moment now to ask ourselves, why do we have a system that is crazy this way? Why do we lock up this many people like that? We need to get less is more past. That's what needs to happen right now. So I think both the kind of fix the foundation problem that led to what a travesty this is, and also respond to the immediate need.
Sure. Dr. Cohen?
Yes. First to honor those who have died and to remember them. That's to keep us engaged, and so that we won't let the pressure down. Very locally, the city should be doing a lot more testing. They should be testing everybody who's coming out, as you requested, and they should be testing. And they should be providing information to all of us about how many tests they are doing, how many are positive, how many are negative, so we can actually understand the nature of this epidemic. They should be publishing data on how many people are hospitalized, and they should be publishing data on how many people are on ventilators in the hospital. And we can't move away from that, but I do think that there's an opportunity within the state to echo all the comments that have been made here to prevent the horror that's going to happen in New York State prison. So we all have to work on that as well.
Sharon? Thank you, Dr. Cohen. Sharon?
I just really piggyback off everybody else. I think there should be testing for all, releasing of pregnant women, release women and children, people who have made their board, close to their board, year to their board, who are medically compromised. And we also need more resources to keep people out of incarceration and that they stay out. So we need to gather those resources as well, because we can advocate for all of that, but it's important that we keep them out. So we need those resources to come together.
Sure. Lorenzo?
Thank you.
Yeah, we got to stand and organizing. You don't win because you're right. You win because you're strong. So like, we have to get stronger here, right? Our organizing's got to be stronger. I invite people to participate in our Phone to Action tool that's on at catalcenter.org. I encourage people to actually go up and read the NYCLU and Legal Aid stuff that they're putting out here, the Brennan Center stuff, and understand that the data would get, obviously this is preached to the choir. The information that we get, I can read you a bunch of stats that make docs sound like they're doing something. And just to bring into this conversation, Donna, right, who's a friend and ally, and we all know Donna. Like, don't assume that a release strategy here accounts for or gives a shit about, right, women and like what's happening around their survival and like their reentry. Donna walked through some stuff on Friday that blew people's minds that women are going through in this situation. And while we're talking about the things that's impacting everybody, we're not talking about the things that's impacting everybody. And I want to tie that back to Sharon's point, tie that back to Donna's layout from Friday, that we gotta have and pay very special attention to. And if you haven't, like, what's happening with like women like in this situation, inside and home. Because they're also the folks who are the head of the households who are receiving people who are coming home.
Yep. Thank you. Assemblyman Mosley, any calls to action?
Obviously, everything that everyone said thus far, I will co-sign off of. I think the most important thing for me, from a legislative standpoint, is to put pressure on leadership. I know Speaker Hasty, criminal justice reform is the thing that he believes he'll be judged upon his effectiveness of his leadership as Speaker in the Assembly. I can't say the same for Senator Andrew Stewart Cousins, but we have to make it a priority of hers. We can't allow for a small minority of senators to dictate how criminal justice policies will go through the legislature. But that's what's happening now. And I think they think they got away with it during the budget process with bail. They believe they'll continue to get away with it, even in the midst of what we're going through, if we don't continue to press them, continue to press her. So when we get back to Albany in May, that this is a priority and is on the agenda to be addressed legislatively. If we don't do that, regardless of what we're doing in our individual silos or in a coordinated fashion, the legislation, which will have a far more impactful, it will be far more impactful throughout the state of New York, won't get done legislatively. So to me, I think we need to continue to pressure the leadership, pressure our colleagues individually, find out where they stand on this issue, and make it publicly known one way or the other. So that's my position from a legislative standpoint.
Thanks again for joining Both Sides of the Bars as you listen to part 2 of our webinar on COVID-19, Rikers Island, and technical parole violations. We ask that you, as the viewer, share the video with others, to talk about it in your homes and among those that you know, because it's critically important that people who are on Rikers Island and exposed to COVID-19 get the support that they need. We thank you again for joining us. If you would like to learn more about what the Fortune Society is doing and to access its services, go to www.fortunesociety.org. That's www.fortunesociety.org. Once again, thank you so much for joining Both Sides of the Bars during this time of COVID-19. We ask that you be safe, you remain well, practice social distancing, and support each other as best you can.